Every day, millions of people take medications to control high blood pressure, heart disease, diabetes, or chronic pain. They trust these medications to keep them healthy. But what many people don't realize is that some of these same medications may quietly affect their hearing. The scary part? The first warning sign is often so subtle that it's easy to ignore. It starts with a faint ringing. Maybe a buzzing sound, a humming noise, or a high-pitched whistle that only you can hear. At first, it lasts just a few minutes. Then, a few hours. Eventually, one day, you realize it never really went away. If this sounds familiar, don't assume it's simply part of getting older. The real culprit might be sitting in your medicine cabinet. When people develop tinnitus, they usually blame earwax, loud noise, or aging. And yes, those are common causes. But there's another cause that many people, even some patients who take these medications every day, have never heard about. Medication side effects. In medicine, we use the term ototoxic medications. These are drugs that can affect the delicate hair cells inside the inner ear, or the auditory nerve. When these structures are damaged, the brain may begin creating sounds that don't actually exist. That's what we know as tinnitus. Now, this doesn't mean everyone who takes these medications will develop ringing in the ears. Most people take them safely without ever experiencing this problem. But if you're one of the people at risk, recognizing the warning signs early can make a big difference. Let's start with aspirin. Millions of people take aspirin every day to help prevent heart attacks and strokes. At higher doses, however, aspirin has long been known to cause temporary ringing in the ears. The good news is in most cases, the ringing improves after your doctor adjusts the dose or safely stops the medication. Next are loop diuretics, especially furosemide. These medications are commonly prescribed for heart failure and severe fluid retention. When used in high doses, particularly through an IV, they may temporarily affect the inner ear, leading to tinnitus or even hearing loss. Another group that doctors monitor very closely is aminoglycoside antibiotics. These powerful antibiotics are often used to treat serious infections. Unlike aspirin, damage caused by these drugs can sometimes be permanent if it's not recognized early. That's why doctors carefully monitor patients who need these medications. If you or someone you love is undergoing cancer treatment, there's another important fact you should know. Certain chemotherapy drugs can damage the inner ear. For many patients, tinnitus appears before noticeable hearing loss develops. That's one reason many cancer centers perform hearing tests throughout treatment. Even common over-the-counter pain relievers like ibuprofen and naproxen may trigger tinnitus when taken frequently or in high doses. Just because a medication doesn't require a prescription doesn't mean it's completely harmless. So, how can you tell if your medication might be causing your tinnitus? Ask yourself these 4 simple questions. Did the ringing begin after you started a new medication? Did it get worse after your dosage was increased? Is the ringing present in both ears? If you answered yes to any of these questions, it's worth discussing with your healthcare provider. But please never stop taking your medication on your own. That's the biggest mistake people make. And if your doctor changed your medication, did the ringing begin to improve? This is especially true for medications used to treat high blood pressure, heart disease, diabetes, or blood clotting disorders. Stopping these medications without medical guidance can be far more dangerous than the ringing itself. Instead, your doctor may adjust your dosage, switch you to another medication, or discover that something else is causing your tinnitus. If there's one message I want you to remember, it's this. If you develop ringing in your ears, don't automatically blame aging. Take a closer look at the medications you're taking. Not because you should fear them, but because recognizing a rare side effect early could help protect your hearing. Sometimes, a simple change in treatment is all it takes to reduce the ringing and prevent long-term hearing damage. If you found this video helpful, please share it with someone who takes medication every day. You might help them recognize a warning sign they've been ignoring for months, or even years. I'm Dr. TienTran. Thank you for watching, and I'll see you in the next video.